Over 2 decades ago, the Niagara Region launched the Physician Recruitment and Retention Program to address the growing need for family physicians across the Niagara Peninsula. This initiative works to attract skilled doctors, support them in their practices, and ultimately enhance healthcare access for residents throughout the region. Joining us today is Jill Croteau, Physician Recruitment Specialist for Niagara Region. Can you tell us a little bit about the origins of the program, Jill, and how it was initially developed?
Yes, so the program was initially developed through the Niagara District Health Council in 2001. So it's been in existence for over 2 decades. I currently have been in the role for about 13 years.
My goodness, that's quite some time. Can you walk us through how the program collaborates with the clinics across the 12 municipalities to place and support physicians?
Yes, so I would keep a pulse on the practice opportunities throughout the region, working directly with clinic owners, municipal representatives, developers, to try and identify what the needs are in the community, and then also taking a look at how many patients are potentially unattached in those communities. Doctor to population ratios, so there's a lot that goes on behind the scenes in terms of health human resource planning.
Right. And so does the Niagara Region take a unique approach in recruiting new physicians to the area? Is there a particular process, I'm wondering, that sets our region apart from some other places that may be doing the same work?
So I think Niagara has been quite successful in the international recruitment circle. We've done a lot of outreach into the United Kingdom, Ireland, the United States to try and repatriate some of our Canadians that potentially were studying abroad that are looking to relocate back to Canada upon graduation.
That's great. Are there certain incentives that are offered to make Niagara an attractive choice for physicians that are looking to start or continue their practices?
Yeah, so I think on top of the fact that Niagara is a wonderful destination for people to live, work, and play, Niagara, I always say that Niagara tends to sell itself to physicians that are visiting the area. But some of the municipalities do offer a financial incentive that can range from a $5,000 grant for relocation equipment, that type of thing, up to $100,000 with a 5-year return of service contract. So that incentive, it does help to retain doctors as well, because after 5 years, they're really settled in the area. So we've seen a lot of retention because of those initiatives.
Right, yeah, so I was going to ask actually, I think attracting folks to Niagara is one thing. There are a lot of wonderful things you're doing to get people here, but once they're here and settled, is there anything in particular that you're doing to retain doctors, and have things changed over the last 20 years?
I probably can't speak to prior than 13 years ago, but I think that advertising for patients is one thing that we do well here in Niagara, aligning people to a primary care provider. And I think that some of the things that we do to help support physicians in their transition, even with their families. So it's when they're moving here with their family, it's as a whole. So educating them on, what opportunities might be available for spousal employment, connecting with real estate, connecting them with accounting, banks, activities for their children. So we're really a conduit into the community, giving them the resources that they need to make their decision.
That's excellent. And so, I think for folks, getting the doctors here is one thing. We have people who really require family care physicians. And why is that important? Important for folks to have a primary care physician, versus, relying on health clinics and things like that throughout the region?
So the differences between a family practice and a walk-in clinic would be that the family doctor is looking at your health holistically. They're following you through your life. They're often looking at your family history. So that type of care, it's very important to address potential, issues that you might have that are that would move forward with you throughout time. So they're your quarterback, essentially, and they're looking at referrals to specialists and following up with that. A walk-in clinic is more a one-time, you have like sniffle, you have a cold, you would go and get a prescription, those types of things. But those walk-in clinics are often not bringing that information back to their primary care doctor. So it's really just I don't want to say a Band-Aid solution, but it really is walk-in clinics are a Band-Aid to us not having adequate primary care family practices in Niagara.
Right. So, I mean, you need all of that, right, to provide a holistic approach to medical care in Niagara. So for people who might be looking, who don't have a family physician, what resources are available for them to find a primary care physician here in Niagara?
So we do have a list of family doctors on our niagararegion.ca/health webpage. So there's about 20 doctors across the region that are accepting new patients right now. That's actually a record number for the time that I have been in here. We've seen a large influx of doctors from the United Kingdom and immigrating into our country. So very highly skilled physicians. I would recommend them. I've worked with them. So I would say that would be a great resource for people to act now and call the name on the list and become a patient of a family physician.
Excellent. Tell us that website one more time.
Yep, it's niagararegion.ca/health, and it's if you Google "find a doctor in Niagara," it's the first page that comes up on a Google search. So.
Thank you so much for being with us today, Jill, and for all the great work you're doing to attract physicians and medical care to Niagara.
Thank you so much for the interview.